He was just a man about to undergo a dangerous surgery. A father, a husband, an engineer who spent his life fixing broken things. But this time, he was the one who needed repair. Doctors said the tumor in his stomach had spread too far. 30% chance of survival if everything went perfectly. And yet, the night before the operation, as the hospital lights dimmed, he did something no medical report could measure. He walked down the silent corridor to a small hospital chapel where a single wooden statue of the Virgin Mary stood beside a flickering candle. There he knelt. "Mother," he whispered, "if I must go, please help me go in peace. But if you can, if you see that I still have something to do here, let me stay, let me live, to serve your son." That prayer would change everything. By sunrise, the doctors who once spoke of statistics would find themselves speechless, because when they opened him up, there was no tumor left to remove. This is the true story of the Houston miracle, and of the man who discovered that sometimes heaven answers in silence. His name was John Matthews, 52 years old, from Houston, Texas. He wasn't a preacher or a saint. He was the kind of man who worked long hours, fixed his own car, and believed faith was something you practiced quietly, between you and God. He had a wife named Angela and 3 children, Lucas, 16, Emma, 14, and little Noah, just 9. For most of his life, John considered himself an average Catholic. He went to Mass when he could, prayed the rosary mostly when things went wrong, and still kept the silver cross his mother gave him when he was 10. In early 2022, after months of fatigue and unexplained stomach pain, a routine checkup turned into a nightmare. The doctor, trying to stay calm, showed him the scan. A shadow inside his abdomen, large, aggressive, and spreading. The biopsy confirmed it: malignant gastric cancer, stage 3. John remembered nothing after hearing the word malignant. He just sat there, staring at the black and white image, wondering how something so silent could be so deadly. At home, he tried to smile for his family. He joked with his kids, made dinner with Angela, but when everyone went to bed, he sat alone on the porch. He thought about all the unfinished things: the family vacation he promised, the fence that still needed fixing, the way he'd stopped going to church regularly after his mother passed. His mother, Margaret, had been deeply devoted to the Virgin Mary. Every night she prayed the rosary and kissed her small medal before sleep. Before she died, she gave that medal to John and said, "Whenever life hurts too much, talk to her. She listens." That medal sat for years in a drawer, until the night before his surgery. The doctors at Houston Memorial Hospital scheduled his operation for 7 a.m. sharp. It would last 6 to 8 hours. The risk was high, and the surgeon had warned his wife, "It's complicated. We'll do everything we can." Angela cried quietly in the hallway as nurses prepared her husband. John squeezed her hand and said, "Don't worry, I'll be fine." But when she left the room, he could feel the fear tightening his chest. That's when he remembered the medal. He asked the nurse if there was a chapel nearby. She nodded, surprised. Most patients preferred to stay in bed the night before surgery. John insisted. He wanted to walk. The hallway was empty. Machines hummed in the distance. When he opened the chapel door, the air felt still, almost warm. There was no priest, no one praying, just him, the candlelight, and the Virgin. He reached into his pocket, found the medal, and held it tight. For the first time in years, his prayer was not rehearsed. It came from the deepest part of him. "Mother Mary, I don't know what's going to happen tomorrow, but I give you my fear, my pain, my whole life. If it's my time, let me go in peace. If not, please help me wake up. Help me see my children again." Tears streamed down his face. He stayed there for nearly an hour. When he finally stood up, he felt lighter, not because the fear was gone, but because it was no longer his alone. He left the chapel unaware that several nurses had quietly stopped by the doorway. They didn't want to interrupt. One of them later would say, "I don't know why, but when he prayed, I felt something in that room, like a mother listening to her child." John returned to his room, kissed the medal again, and whispered one last line before drifting to sleep. "I trust you, Mother. Whatever happens tomorrow, I trust you." The hospital never truly sleeps. Even at midnight, lights hum behind frosted glass, Monitors beep softly in distant rooms, and somewhere down the hall, a nurse whispers a quiet prayer before checking another patient's pulse. For John Matthews, that night felt endless. He lay awake, eyes fixed on the ceiling, the faint smell of antiseptic filling the air. Angela had gone home to rest, though neither of them would sleep. On the bedside table lay two things, his wedding ring and the small silver medal of the Virgin Mary. He turned it over in his fingers, tracing its edges. It was worn smooth from years in his mother's hands. In the dim hospital light, it shimmered faintly, as if alive. At one point, the night nurse came in to adjust his IV. She noticed the medal and smiled. "My grandmother used to have one just like that," she said softly. "She said the Blessed Mother protected her through every storm." John nodded, unable to speak. For the first time, he wasn't afraid to admit how much he needed that protection too. When the nurse left, he closed his eyes. But sleep didn't come, only memories. He saw his children laughing at the dinner table, the backyard swings swaying in the evening wind, his mother praying by the window, her voice low and gentle. He realized how often he had taken all of it for granted, how easily he had said maybe later to moments that would never return. At 2:17 a.m., unable to rest, he pressed the call button. The nurse returned, thinking something was wrong. He simply asked, "Could I go back to the chapel again? Just for a few minutes?" She hesitated. It wasn't common, but something in his eyes made her say yes. She unplugged the IV line from the wall, placed the rolling stand beside him, and slowly guided him through the corridor. They moved past dark rooms and empty waiting chairs, the air heavy with the hum of machines and the faint scent of flowers from the gift shop below. When they reached the small chapel, she held the door for him, then quietly stepped away, leaving him alone. The same candle burned beside the statue of Mary, its flames steady, unbothered by the air conditioning. John knelt once more. This time, he didn't ask for healing. He only said, "If I don't wake up tomorrow, please stay with them, with Angela and the kids. Let them know I love them." He bowed his head, and for a brief moment, he felt a warmth behind him, gentle like someone placing a hand on his shoulder. He turned around. No one was there, but he smiled anyway, because somehow he knew he wouldn't be alone in that operating room. At dawn, the first light of Houston filtered through the hospital blinds. The city was waking up, but inside the surgical ward, time stood still. John Matthews was rolled toward the operating room, wrapped in white sheets, his medal of the Virgin Mary resting against his chest beneath the gown. Angela walked beside the gurney, holding his hand until the last possible moment. When they reached the sterile double doors, she whispered, "I'll be right here when you wake up." He smiled faintly. "I know." Inside, everything was prepared. Monitors blinking, stainless steel gleaming under cold fluorescent light. The surgical team moved with quiet precision, their faces half hidden behind masks. Dr. Helen Rodriguez, the lead surgeon, reviewed the scans one last time, a large irregular mass along the stomach lining, extending near the pancreas. It was going to be long and complicated. "Let's begin," she said calmly. They placed the oxygen mask over John's face. He caught a final glimpse of the ceiling lights above, blinding circles that faded into blur. As the anesthesia took hold, one thought echoed in his heart. "I trust you, Mother." Minutes turned into hours. The surgeons made the first incision. Every motion was deliberate, every breath measured. Then came the moment they expected to find the tumor. Dr. Rodriguez pointed to the spot marked on the scan. "Right here," she said. "Careful, watch the vessels." But as they moved deeper, something was wrong. There was nothing. The assistant adjusted the scope. "Doctor, I'm not seeing it," he murmured. Dr. Rodriguez frowned, leaned closer, and rechecked the landmarks. "This doesn't make sense," she whispered. She asked for the scan again, checked the coordinates twice. The tumor that had measured nearly 6 centimeters 2 days ago was gone, completely gone. "Are we sure this is the same patient?" one of the nurses asked quietly. The ID bracelet matched. The barcode matched. The internal anatomy matched. Everything pointed to the same man, except for the disease that had vanished. For a long moment, no one spoke. All you could hear was the soft rhythm of the heart monitor. Steady, calm, alive. Finally, Dr. Rodriguez exhaled slowly and said, "Close him up. There's nothing left to remove." They finished the procedure in silence. When the last suture was tied, the surgeon stood still, staring at the monitor. In 23 years of medicine, she had seen miracles of science, but never one that defied it so completely. When John was wheeled out of the operating room, the air in the surgical wing felt heavier than usual. Dr. Rodriguez removed her gloves and leaned against the counter, eyes fixed on the floor. No one spoke for several seconds. It wasn't just confusion, it was disbelief. Finally, her assistant broke the silence. "Could the scan have been mislabeled?" "No," she replied firmly. "We double-checked his ID when we started. This is the same man." She walked to the viewing screen, replaying the pre-surgery scans. The tumor was there, clear and dark, with sharp edges and vascular invasion. No radiologist could mistake it for anything else. And yet, when she looked at the images taken during the operation, nothing. Smooth, healthy tissue, no trace of disease. Dr. Rodriguez ordered a pathology review. Within an hour, a technician arrived with the surgical notes, frowning. "Doctor," he said quietly, "the samples you sent, they're all normal, not even inflammation." She blinked. "Check again. Check the entire cavity if you have to." They did. Twice. Every test came back the same. No malignancy, no scar tissue, not even residue from the tumor bed. It was as if the cancer had never existed. By noon, the operating team gathered in the conference room, papers spread across the table, monitors glowing with side-by-side comparisons. Dr. Rodriguez looked around the room. "I need to hear everyone's thoughts." A younger surgeon hesitated, then said what everyone was thinking. "We all saw the scans. We all know what we expected to find. But what if it wasn't medicine that fixed this?" There was an uneasy silence. Doctors aren't supposed to use the word miracle, but that day it hung in the air, unspoken, undeniable. Dr. Rodriguez leaned back, rubbing her temples. "I've been in this field 23 years, she said quietly. "I've seen spontaneous remissions, yes, rare ones, but not like this, not overnight." Then one of the nurses, the same woman who had helped John reach the chapel the night before, whispered almost to herself, "He prayed to the Virgin Mary. I saw him. He was crying." Everyone turned toward her. No one laughed. No one argued. Dr. Rodriguez folded her arms and stared at the patient's chart. All logic said it was impossible, but deep down, something in her heart stirred. A feeling she hadn't known since childhood. "Document everything," she finally said, "and keep the scans, all of them." As she walked out of the room, she glanced toward the chapel down the hall. For the first time in years, she felt the urge to pray. When John Matthews opened his eyes, everything felt strangely quiet. The fluorescent lights above him glowed soft and pale, and the rhythmic beeping of the heart monitor pulsed like a distant clock, reminding him he was still here. For a moment, he didn't know where he was. Then he saw the white curtains, the IV in his arm, and the familiar face of Dr. Helen Rodriguez standing beside his bed. Her mask was pulled down, her eyes slightly red, as if she'd been crying. "Mr. Matthews," she said gently, "can you hear me?" He nodded weakly. "Yes. Is it over?" "It's over," she replied, her voice trembling slightly. "But I need to tell you something." Angela rushed into the room at that moment, tears already spilling down her cheeks. She clutched his hand as the doctor continued. "We opened your abdomen expecting to find the tumor," she said. Her tone was calm but distant, as though she still couldn't believe her own words. "But there was nothing. It's gone." John blinked, confused. "Gone?" "Yes, completely." She paused. "We've reviewed the scans, the lab work, everything. There's no medical explanation. You're clean." For a long moment, no one spoke. Angela covered her mouth, shaking. John looked at her, then up toward the ceiling, a white expanse of light that seemed to shimmer softly. He whispered, barely audible, "Thank you, Mother." Dr. Rodriguez lowered her gaze, then quietly excused herself from the room. In the hallway, she leaned against the wall, breathing deeply. A nurse approached and asked, "Are you all right, doctor?" She nodded slowly. "I just don't understand," she murmured. "It shouldn't be possible." Back inside, John held Angela's hand and smiled weakly. "I told her last night," he said, "if it was my time, I'd go in peace. But if she let me stay, I'd live differently." Angela kissed his forehead. "You will," she whispered. "We both will." And for the first time since the diagnosis, John didn't feel fear or pain, only peace. A peace that felt almost divine. By evening, word of John's recovery had already begun to ripple quietly through the hospital. Doctors whispered in hallways, nurses exchanged glances. It wasn't just that he survived, it was how. Around 8 p.m., the nurse who had escorted John to the chapel the night before returned to check on him. She was still processing what she'd witnessed that morning, but something else had begun to spread among the night staff. A rumor, almost a secret. Someone had seen a strange light in the hospital chapel. At first, she thought it was a reflection from a passing ambulance, but when she went to see for herself, the light didn't move. It hovered gently around the statue of the Virgin Mary, a pale bluish glow that pulsed softly, like breathing. No one spoke. Two other nurses joined her, standing by the doorway in silence. There were no candles lit, no open windows, no mirrors to reflect the light, and yet the entire room seemed to shimmer in quiet warmth. One of them whispered, "It's the same statue he prayed to." The glow lingered for several minutes before slowly fading away, leaving behind a faint scent. Roses, clean and sweet, though there were none in the chapel. The next morning, staff from other floors came to see for themselves. A few knelt briefly before the statue. Some left flowers. Others just stood there, their hands folded, trying to understand what had happened within those walls. Later that week, a janitor found a small card tucked at the base of the statue. It was John's handwriting, shaky but clear. "Thank you, Mother. You never left me." From that day on, the chapel was never empty. Visitors came from other wings of the hospital, patients, relatives, even doctors who had long stopped believing in miracles. They sat quietly, sometimes weeping, sometimes just breathing in the stillness. And those who were there that night, those who saw the light, never forgot it. Because for a few minutes in a quiet hospital in Houston, it felt as if heaven itself had come to visit. Within days, the case of John Matthews became the most talked about story inside Houston Memorial Hospital. Not because of publicity, there was none, but because every doctor, every technician who reviewed the files came to the same impossible conclusion: the cancer had vanished. Dr. Helen Rodriguez tried to stay rational. She gathered the radiology team, the oncology department, and the pathologists for a closed review. They compared the original CT scans, the MRI data, the biopsy slides, and the surgical footage. Everything pointed to one fact: John had cancer before the operation, and during surgery there was nothing left to remove. "Could the scans have been corrupted?" one specialist asked. "No," Helen replied. "Different machines, different dates, the data's consistent." She reached for the pathology slides and placed them under the microscope once more. She wanted to find even a trace, a scar, a burned tissue edge, something. But every cell was normal, perfectly normal. For hours, the room was silent except for the hum of machines. Finally, one of the oncologists leaned back and muttered, "We can't write this off as error. This man was healed, but not by us." Those words unsettled everyone. Doctors aren't trained to say miracle. They are trained to find reasons. Yet here, all reasons had vanished, just like the tumor. The following week, Houston Chronicle received an anonymous tip from a hospital staff member. The headline that appeared 2 days later read, "Man's cancer disappears overnight. Doctors at a loss." Dr. Rodriguez's phone began to ring nonstop. Journalists, local pastors, even skeptics wanted interviews. But she refused them all. When a reporter finally caught her outside the hospital parking lot and asked, "Doctor, do you believe this was divine intervention?" She paused, then answered softly, "All I know is medicine didn't do it." The hospital's ethics board reviewed the case for 3 months. Every test came back authentic. The board quietly closed the file under the classification spontaneous remission. Cause unknown. But Dr. Rodriguez didn't forget. On her lunch breaks, she started stopping by the chapel, the same one where the nurses said a light had appeared. She didn't kneel or speak. She just stood there staring at the small wooden statue of the Virgin Mary, wondering why a woman she'd never prayed to now occupied so much space in her thoughts. News travels fast in a hospital, but faith travels faster. Within 2 weeks, the story of John Matthews had spread beyond the sterile walls of Houston Memorial. People came not for treatment, but to see the place where something unexplainable had happened. It began with the nurses. Those who had worked the night of the surgery spoke in hushed tones, sharing small fragments of what they'd seen. The light, the scent of roses, the quiet peace in the chapel. Some of them began leaving small candles near the statue after every shift. Others brought fresh flowers, and soon even patients began joining them. A mother whose child was in intensive care knelt before the statue and whispered, "If you healed that man, please help my son too." A few days later, her boy began to recover faster than doctors expected. Coincidence or grace? No one dared to define it, but those who witnessed it felt something more than chance. Local parishioners from St. Joseph's Catholic Church, just a few blocks away, heard about John's recovery. The parish priest visited the hospital to meet him. When he entered the room, John was sitting up, rosary in hand, eyes filled with quiet gratitude. They prayed together. Not a dramatic scene, but a humble one. A man simply thanking heaven for another sunrise. Within a month, the small hospital chapel was filled every evening. Doctors, nurses, visitors, even non-believers, came to sit in silence. There were no sermons, no official declarations, just the unspoken awareness that something sacred had happened here. One evening, a janitor, the same man who cleaned the floor outside the chapel, was interviewed by a local Catholic radio station. He said, "I don't know what people call it, a miracle maybe. All I know is, after that night, this place feels different. It's quieter, kinder." And across Houston, people began referring to the story simply as the Houston Miracle. A modern event whispered like a legend, a sign that even in the age of science and technology, the Virgin Mary still walks among the sick, and sometimes still heals with a mother's touch. 6 months after the surgery, John Matthews looked nothing like the man who had entered the hospital that April morning. The tired eyes were gone. The pale skin had regained color. He moved with the energy of someone reborn, not just healed, but transformed. Every 3 months, he returned for follow-up scans. Each one showed the same result: clear, healthy, untouched by disease. Doctors still couldn't explain it. John no longer tried to make them. He spent his recovery days walking through his neighborhood in southwest Houston, sometimes carrying his rosary in his pocket, sometimes stopping by the nearest parish just to sit in silence. Neighbors would wave and say, "You're the miracle man," and he would smile humbly and answer, "No, just a man who was reminded that heaven still listens." He began speaking at small parish gatherings, men's prayer groups, youth retreats, hospital ministries. He never dramatized his story. He simply told it as it happened: the diagnosis, the fear, the prayer, and the impossible healing. Then he'd hold up the small silver medal of the Virgin Mary, the one that had once rested in his mother's hands, and say, "This is not magic. It's a reminder that love never stops watching over us." Angela noticed how gentle he had become. He no longer complained about traffic, deadlines, or small inconveniences. Every morning before breakfast, he would stand by the window and whisper, "Thank you for another day." The children changed too. Lucas started attending youth mass again. Emma began volunteering at the parish food pantry. And little Noah proudly told his teacher, "My dad got better because Mother Mary helped him." At home, the family began praying the rosary together each evening, a habit that had once belonged to John's mother, now reborn in her son's home. He no longer feared death because he had seen what faith could do in the face of it. And from that day on, John promised himself one thing: every breath he took would be a thank you. By early 2023, the story had reached far beyond Houston. Catholic newspapers picked it up first, then podcasts, parish bulletins, and finally national media. But what fascinated people most wasn't the medical mystery. It was the humility of the man at its center. When journalists asked John for interviews, he refused most of them. He didn't want fame. He only agreed to speak if the story could help someone else believe again. "Don't talk about me," he told one reporter. "Talk about the one who listened." The hospital chapel, once quiet and nearly forgotten, had become a place of pilgrimage. Families drove in from neighboring towns, from Dallas, Baton Rouge, even Oklahoma, to kneel before the same statue where John had prayed. Nurses began keeping a small notebook beside the altar for visitors to write their petitions and words of thanks. Within weeks, the pages were filled. One evening, Bishop Michael Alvarez of the Diocese of Galveston, Houston, arrived quietly, without announcement. He spent nearly an hour in prayer, then asked to meet the hospital administrators. He didn't promise a formal investigation, not yet, but he asked for all medical documentation, witness reports, and photos of the statue. In his Sunday homily the following week, he said to his congregation, "When the Mother of God acts, she doesn't seek attention. She appears quietly, where suffering is greatest, and through her, the heart of her Son continues to heal the world." The words spread like light through stained glass. Suddenly, people who hadn't prayed in years began dusting off their rosaries. Hospitals requested more chaplains. Faith, once considered old-fashioned, felt new again. Doctors from Houston Memorial continued to study the case. Their reports used careful language. Spontaneous remission, non-replicable phenomenon. But those who had been in the room that morning knew better. They had seen something that could not be graphed or measured. And somewhere in a quiet Houston neighborhood, John Matthews lit a candle beneath a small statue of the Virgin Mary in his living room. He looked at the flame and smiled. "Let them call it what they want," he whispered. "I know what it really was." Sometimes John would sit alone on his porch at dusk, the Texas sun melting into shades of gold and violet. That was when he prayed most, not with words but with silence filled with gratitude. He often thought back to the night before the surgery, to that moment in the hospital chapel when he had nothing left to offer but fear. And he realized now, that was the very moment grace began. When visitors asked him what the miracle meant, he always gave the same answer. "It wasn't just that my body was healed, it was that my heart was changed. I stopped living in fear and started living in thanksgiving." He spoke gently, never as a preacher, always as a witness. He told people that miracles are not rewards for being perfect. They are signs of love for those who are desperate enough to ask. He said, "Faith doesn't guarantee life will be easy. It means you won't face it alone. The Virgin Mary didn't take away my suffering. She walked with me through it." That line stayed with everyone who heard him. Some came to him looking for hope. Others came simply to listen to someone who had truly seen light in darkness. John would smile and say, "The world doesn't need more proof of God's power. It needs more reminders of His mercy." He kept a simple wooden cross on his wall and a photo of the hospital chapel below it. And beneath the photo, he wrote in his mother's handwriting, "She listens." For John, that was the essence of the miracle. Not a flash of light or a vanishing tumor, but a whisper in the silence of fear saying, "You are not alone." The story of John Matthews isn't about medical wonder. It's about a man who found heaven in the quiet corner of a hospital chapel and discovered that love never stops reaching for us, even when hope seems gone. You may never face an operating table or hear the word cancer, but each of us knows what it means to be afraid, to stand at the edge of something bigger than ourselves and whisper a prayer we're not sure anyone will hear. John's miracle reminds us that those prayers do not vanish into empty air. They rise. They are gathered by the same mother who stood beneath the cross and who still walks the corridors of pain, grief, and doubt, bringing light where there was none. Maybe your miracle won't come as a blinding light or a vanished disease. Maybe it will come as peace after tears, as forgiveness long delayed, or simply as the strength to keep going one more day. Whatever you're carrying tonight, speak to her. Whisper it honestly, because somewhere in ways we may never see, she is listening. If this story touched your heart, share it, not for fame, but for faith. Leave a comment below with the name of someone you'd like to pray for tonight. And remember, miracles are not only memories of the past, They are invitations to believe again. Av miracles, real stories of faith, hope, and love in our modern world.